So 15 years of experience, rapid growth, legislation obligations, a lot of implementation quickly. We are efficient, okay? So we're doing our job quite well. And I think our new executive director has been saying that before. We are a robust organization, high level of commitment. So this is working. But does that mean that we need to stop and just do the same thing as we used to do? The answer is, of course, no. You know that because of the financial current environment, things are changing. So we need also to change and to adapt. The numbers of, let's say, of submission are growing. The transparency policy, just to give you some figures, we released 8,000 pages last year, and this year as we speak now, we're more than 1 million pages. There's a lot of redaction to do. There's a lot of internal activities. So these are, among others, the drivers for operational excellence, which means being more efficient or being more effective. And when we talk about efficiency, people say, okay, what does that mean exactly? Effectiveness, what does that mean? It means doing the right thing and doing the things right. Okay, and I actually have a lot of compassion for Inframed because we have the same environment, and I'm sure you have the same also environment. Less money, we have to do more. New legislation, pharmacovigilance implementation. Noel, you know what I'm talking about. So these are, once again, the drivers for operational excellence. And I would like to take the opportunity of this hours or sessions to go a little bit more deeper. So if you have specific questions, and I would like to address this like this, just ask them, and then I will reply. I could go deeper into operational excellence, but I would like to approach it like this. We have a couple of sessions this afternoon, and session 4 that will talk about e-submission, and we have Claudia, yes, and Tim as well, who is working on the validation process improvement. We also have Brigitta, who is liaising with the member states and the national competent authorities to make sure that we have a consistent approach in terms of validation. Okay, so the final word for me will be actually what is behind, what is the OPEX rationale, and it's 4 very, very simple points. The first one is to improve efficiency to better handle our workload, is to make our life, not only the agency, but the network life, but also your life, simpler. Transparent, compliant, but also transparent and efficient. The second one is to save money, because we have to save money, to do more with less. Maybe to reallocate resources to our core activities. And final point will be to demonstrate European best practice. Okay, so I would like to thank you for the opportunity to present operational excellence, and if you have further questions, please, welcome.
Thank you, Jean-Claude. It's certainly a topic which will come back at future TOPRA meetings. So the floor is now open for questions. So if you want to put a question to us, please state your name and your affiliation and speak into the mic. Thank you. Ladies first.
Yeah. My name is Marita Schmiegelow from Regulatory Intelligence and Policy from Novo Nordisk. I have a question regarding the unmet medical need, where we continue to say we had to stimulate the innovation and cover those areas. Looking upon the changing R&D paradigm, where we understand diseases much more, where several of our existing approved products may be used for completely different diseases. And we know that incentive as such has importance. And we also know that EMA, of course, are not responsible for the regulations around data exclusivity and so on. But does EMA see any areas where they can contribute to stimulate innovation also within our approved products for new use?
Probably none of the people in the panel is a specialist in this area, but I'm going to put the hot potato to Emer Cook.
Well, I think we do recognise the challenge. We do recognise that it's not going to happen spontaneously. But we think there's a lot of information in dossiers that may never make it to market that could be possibly exploited for other uses. How that would be done would require engagement with the industry developing it. Would also involve engagement with research bodies, possibly public funding institutes. There are some discussion about looking at incentive schemes, but of course that wouldn't be us who would do it. That's outside our responsibility. We think there's scope for looking at how we can work together with with international regulators to try and stimulate medicines development in such areas, or indeed in the unmet medical needs. This also involves collaboration with WHO. So there are we have a lot of ideas behind what might be what we could do here. But I would say we don't have a coherent answer or a coherent strategy at this point. We're exploring options. It's somewhere we definitely think the industry has to help us to come up with some ways of working in this area.
Thanks, EMA.
Thank you. To my right, yes.
Nick Sykes from Pfizer. So I've got two questions that are tentatively linked, I guess. One is around operational excellence and essentially asking, are you seeking any input from stakeholders, such as the industry, on where we feel that the EMA could be efficient in terms of their procedures? I'm sure across this room we could collectively come with a whole range of ways that we feel that the EMA could be more efficient. And the second one is probably aimed at EMA to some extent, is around the budget, and really asking what sorts of implications would budget restrictions have on delivery of the EMA roadmap.
Jean-Claude?
So to answer to your questions, yes. How, it's not defined yet, but we are doing it on a, let's say, one-to-one basis, or this kind of thing. So we're using different forums for that. So the TGS is one of them. What I've decided to do is definitely to have a long-term approach, and this is starting actually in June. Well, if we have the approval from the executive director, it will start in 2012. But in the meantime, we're delivering, let's say, results on different projects, and the validation process improvement is one of them. So for now, we're getting inputs from the industry via the TGS and other existing firms.
Before giving the floor to Emer on how the budget may impact on the execution of the roadmap, what is also important in terms of operational excellence, and we have seen it, we have now some examples where indeed we can increase our efficiency, we can save resources, but there are, I would say, two important constraints to it. The first one is that we have to make sure whatever process re-engineering we are doing, that we comply with the spirit of the legislation. The second one is that the quality of the outcome should not be compromised. So I think these are two very important points. You can do a lot in terms of process re-engineering, but I think nobody in the outside world would accept that the quality of our work would be compromised. Emer, budget and roadmap?
Yes, I think I tried to explain that we do realize that not all the aspirations in the roadmap are going to be achievable with current resources. In fact, we already put that in the preamble to the roadmap because we know that we're constantly faced with additional tasks that we can't necessarily anticipate 5 years in advance. Now, we're wedded to the 3 objectives, But whether or not we will achieve everything in those in those 3 strategic areas really remains to be seen. At the moment, we're foreseeing a gradual approach. What you see and what is translated into the annual work programs is what will be delivered upon. After about halfway through the cycle, we're going to look at it again, see whether we actually need to revise aspects just in terms of managing expectations. But I think we're already convinced that not everything is going to be achievable because of resource constraints and because of additional requirements that we're faced with. And we will revisit, and we will seek input from stakeholders when we revisit.
Any other questions? Yes?
2 questions, if I may.
Your name, please.
Fiona Riki from Janssen of Johnson & Johnson. My first question is for you, Noel. When can we anticipate issue of the final guideline on transparency of the CTD, and also publication of the documents that have already been released on request?
Sorry, and the second, because I couldn't understand one part of it.
The second part was, when will documents that have already been released on request be published on the website?
Okay. So, perhaps I can also address a question from Judith in terms of where we are with transparency, because that was not really addressed in any of the presentations so far and will not be addressed afterwards. First of all, in terms of access to documents, because we have to distinguish between our legal obligations, which are a number of transparency measures put down in the legislation, and complying with Regulation 1049/2001, which is the access to documents policy. One of the issues which required further consideration was indeed commercial confidential information and protection of personal data. Together with HMA, and you were part of that group, also EMA, we drafted a guidance document which went through public consultation. That has now been finalized. It was agreed upon by HMA at a meeting in Gdansk, and perhaps Nuno or EMA could say something about when this is going to be released into the public domain. The principles, of course, will now have to be applied by EMA, by national competent authorities. What we have seen is that the devil is always in the detail. When you talk, for instance, about personal data legislation and adhering to it, how far do we have to go? For instance, if you provide access to company data, the names of investigators for clinical trials, for preclinical trials, do we have to suppress them or not? Patient details, all that kind of stuff. So we have some questions are more easy to answer than others. What we are doing at this moment, because this is a quite tricky issue, is that we are summarizing all the areas where we still have some level of uncertainty, and we are liaising with the European Data Protection Supervisor in order to have his opinion on those nuclei, I would say, where we still have a number of questions. In terms of, so that's to answer your first question. The second question in terms of are we going to proactively publish what we have already released? That is planned. So we have a stepwise approach in access to documents, first reactive, then proactive, and Jean-Claude is working on it as well. So this will be something that we're going to envisage for 2012. We'll come up with an implementation plan with a priority ranking, etc., in terms of the proactive publication, including those for which already access has been granted. A third point then, transparency as such. Of course, transparency can go beyond the legislative requirements, and that is what we're currently looking into, and we have put it a little bit, we have stopped a little bit the whole process. Why? Because we have quite a number of transparency initiatives that have to be implemented with the new pharmacovigilance legislation. And my dada is public hearings next year. How do we envisage public hearings? And it has already been raised at a number of stakeholder meetings. It can be simply for transparency reasons. It can be engagement of stakeholders in the scientific review process. I think where there is a consensus, if I may say, amongst the regulators is that public stakeholders should, stakeholder meetings, or public hearings, sorry, should be at the end of the day an added value to the outcome of the scientific review as a starting point. And then you have different ways in order to start implementing that. So all this needs to be further looked into, and we envisage having this transparency policy together with also communication strategy somewhere in 2012. I don't know, Emer or Nuno, in terms of the guidance document.
Yeah. Just to nuance what Noel said. Nuance, yes. Because what we have completed the consultation period. We've got comments back from, I think it's 24 different organizations. We have reviewed those comments at a HMA EMA group, and we've agreed on a general approach to how we will address the most common comments. What we haven't done is actually revise the guideline accordingly, and we have a meeting on the 9th of December where the working group of the HMA and EMA will come together. We've divided up the document to get different specialists to look at different parts of the document. We hope that will then lead us to revised guidance plus an overview of comments with the rationale why the comment was taken into account or not taken into account. So I think we're looking at first quarter next year for that finalization.
I thought you were working quicker, but okay.
Yes,
I was mistaken.
Well, just in case it's going to be reported in some of the publications that we've finished, and there might be a bit of disappointment, I thought we needed to clarify.
Okay. Then you had to nuance. That's correctly. I saw somebody wanted to. Yes.
Jose
Please.
Falcon, MHRA. I would have two questions, one for Emer and another one for Nuno. For Emer, I would like to know, still refers to the early appointment of rapporteurs, at which stage of the drug development program she's thinking about, and also about better links between PDCO and CHMP. And I will have another question also for Nuno, and he mentions the common submission platform for MRPs and DCPs. And I would like to know whether that's going to be also implemented for centralized procedures, whether he's referring to yours is yours, and that's all. Thanks.
Let me start with the better links between the PEDCO and CHMP, because there's been quite a lot of activity in this area recently. One of this work is an ongoing work. We have various established means of cooperation between the two committees. But we need to constantly be looking at ways to ensure that both committees are fully informed about what's going on in areas of common interest. One of the ideas that's being looked at now is possibly to have a summary to make sure that the PTLs include a full summary of the relevant issues that have been discussed in one committee when reporting to the other committee, and this could help the rapporteurs, particularly in CHMP, to perform their assessment process. Apart from that, I have to say that our new executive director has taken the challenge of linkages between all the committees very seriously, and he's hoping to set up a meeting involving all the chairs early in 2012, where issues relating to the best practices for working together will be addressed. With respect to early appointment of rapporteurs, I think your question was precisely at what stage the rapporteurs would be appointed.
You still need
I think we're not yet at this point because it's something we're still exploring, but I can't give you a definite timing as to where we think this would go. I want to stress that in the plans we've made it clear that this would be a voluntary process. And as I said, more work is to be done in this area before I can give you a definitive answer.
And the e-submission platform?
The Common European Submission Platform, this is up until now basically a HMA project. It's been under development by the HMA Telematics Support Group, and it is meant, at least until now, only for MRP and DCP applications.
Final question, I saw somebody. What? We have to close. Yeah, but there was one person there that I would like to take, but then we have to close, because otherwise you will have no coffee, you have no lunch if you continue like that. So that person has been asking for the floor, and that's the final question. Short question and a short reply.
Yeah, so it is a short question. It's Ali Harrison, AstraZeneca. So the question is in regards to transparency. Can the agency state at the moment that they are willing to release assessment reports to, for example, pricing bodies and health technology assessment bodies such as the GBA in advance of either the opinion or the decision being granted on an MAA? Because the GBA is citing at the moment that the EMEA is willing to release those reports, and I think that's going to be an important point for a number of people in the room. Thank you.
Not that I'm aware. So I think we are providing those reports once the decision has been taken. And decision has been taken, as we specified in the access to documents policy, is the availability of a commission decision.